Well, hey friends, I'm back here interviewing a couple more people about just a few of the things, a few topics that we might be interested in, or that might really help us right now. That we're separate from each other, that we're physically distancing from each other. I know the last one I posted was with Kristen Langstrat. She works in the CPE department with yeah, you know Kristen, yeah. But yeah, the last one I posted was with her. Some like practical self-care pieces that we could take away. That was really great. And now I'm talking with, if you're a part of Church of the Savior, you'll recognize her, Lauren. And then one of my friends from seminary, Lorenzo. Both of them are healthcare workers, and we've heard a lot about the role of healthcare workers right now. So I thought, since I know both of them, I thought it'd be a good time to have a talk with them. So we'll start with you.
Okay.
Even though this is on the church YouTube channel, most people who are going to see this are going to know you. But intro yourself and your role and how long you've been working there.
Okay, so I'm Lauren Burns, married to Pastor Andy, for those of you who don't know. I work as an occupational therapist. If you don't know what that is, I work with people to get back to all the things they like to do to occupy their time. So it could be getting dressed, going to the bathroom. It could be gardening, cooking, different things like that. So I work a lot in helping people get ready to go back home. I currently work in a skilled nursing facility in Pickerington, and I have officially been there for 6 months. So this week I'll get recognized at my staff meeting and I will get upgraded in my company. You have a blue badge the first 6 months, and then once you've been there 6 months, you get a white badge. So I'm pretty excited about that.
That's awesome. So Lorenzo, intro yourself and your role and how long you've worked there.
Sure. So I'm Lorenzo Thomas. I'm an ordained minister with the Disciples of Christ, and I'm a healthcare chaplain at Mount Carmel East. I'm the night chaplain. So if you're at East at night, you have a 5 out of 7 chance of seeing me. I've worked at Mount Carmel a little under a year, and I worked at Ohio Health part-time for close to 4 years. And what was there a third thing I was supposed to say?
I explained what OT is, so
yeah.
Oh,
Tell it what does a hospital chaplain do? If you haven't really had a long stay at a hospital, you might not know that. So what does a hospital chaplain do?
Sure. So it'd probably be easier to list what I don't do. Hospital chaplain, we're just religious leaders inside of an institution. So part of my job is providing spiritual care specifically for everybody, but for Protestants in general. And then I also provide emotional and spiritual support to people going through really hard times. They have to get really bad news, diagnoses or deaths or stuff. We're right there with everybody. And then one of the reasons I love nighttime chaplain work is most of my role is towards the staff. So as daytime chaplains might round and see a lot of patients, most of the time, all of my patients are asleep. So I get to go to the units and hang out with the nurses and the doctors and the techs, everybody that makes the hospital run.
Awesome.
Yep.
So with the coronavirus, with COVID-19, healthcare workers have all of a sudden gotten a whole national spotlight in various different ways. So whichever one of you wants to go first, how is COVID-19 specifically, how has this affected your job or your role compared to what it was before the pandemic?
You can go first if you want, Lauren.
Oh, so the most drastic thing for me has been the social distancing. It became pretty apparent to me how much my job depends on physical touch. I would never have thought that earlier, or it was one of those things that but you never really pay that much attention to until you can't any longer. But when someone is grieving, there's a lot of physical touch that goes into consoling someone, whether that's a hand on the back or holding the hand of a patient. But that's a no-no right now. So it just became really this contrast of words to touch, and now I'm using a lot more words because I can't get more than 6 feet from certain patients, and yeah, that has been very odd.
Yeah.
What like percentage or area of your hospital has COVID patients right now?
So we get updates every day, and it seems to change every day, but I feel like it might be somewhere between 10 and 15.
Okay.
Yeah.
So 10 and 15% of the patients in your hospital have
Are
COVID-19.
actually quarantined and in isolation and in like the things that you see on TV where no one can go in.
Yeah.
Mm-hmm.
So what is your job as the chaplain look like then? If they're quarantined, does that mean you cannot go in, or you can, or you do go in?
No, I do not go in. We can go up to the door of the patient's room. And like I said, at night, my role is a little different because so many patients are asleep. I start at 11 at night. So I have not been on the floor other than to drop off a Bible. A family member requested a Bible. And so I went up to them. This was actually kind of an interesting story too. That's odd. One of our ICU floors, a floor that I would go on all the time, it was turned into a COVID floor. And so I go up to this floor that I'm used to going up to and seeing staff that I normally would see, but the doors going to the actual rooms are closed. And so instead of going on these floors that I'm used to, I stop at the nurse's desk and I like go no further. And it was just, it was odd. It felt like, ooh, this is weird.
Mm-hmm.
And instead of walking this Bible to a patient's room and giving it to the family member and then starting a conversation, it's like that's where my work is done.
Yeah.
But I had to stop at the nurse's desk and give the nurse the Bible, who then suits up and takes it to whoever. It was just this strange,
Yeah.
I hate to use the word, but almost like dreamlike situation. And then I spoke with the staff a little bit, and I just said out loud, "Oh, I guess this is it. I don't. Nothing really more I can do here." And I think there's probably a lot of chaplains across the country and across the world who have had that moment where you stop and go, "Oh, I guess I just can't really do. What can I do here? I don't know. It's so crazy when you have to kind of hold yourself back because of the quarantine."
Yeah.
That's crazy.
What about you?
So for me personally, so skilled nursing facilities have gotten a lot of press in the news for kind of being almost like breeding ground for COVID because of the population that we work with. The building that I am at is a non-COVID building, and my company is trying to keep all of our buildings that are negative campuses that way, which I am very grateful for. But we've had some changes. So I now have to enter the building from one main door. I get my temperature checked when I come into the building. I get my temperature checked when I leave the building. Since we're low on our personal protective equipment, I keep my N95 mask and my surgical mask in a brown paper bag with my name on it that gets stored in a bin at my facility. So that mask never leaves the building, and I'm basically wearing this N95 mask until who knows when. For my everyday, like day-to-day work, I'm still allowed to see the patient. So when I'm actively with a patient, I wear my N95 mask, which is the big mask that covers your whole face. But I work with older adults, and it's very hard for them to hear. And so me wearing a mask and them not being able to see my face makes that a little difficult. So I have the opposite effect as you, Lorenzo, is I still get to have that physical contact with my patients, but that's only because I'm wearing my N95 mask. So on a normal basis, everything for our residents are now in their rooms only, pretty much. All their meals are in their rooms. All activities can be done kind of in the hallway. For a while, I was just in-room treatments. Now we can bring them to the therapy room, but we have restrictions on we can't have more than 4 in the therapy gym. We have to clean like crazy. I wash my hands all the time. We wipe down all of our equipment. We spray at the beginning of the day and the end of the day. We wipe down equipment between patients. And there's a lot of my residents who are new to the facility and new to me, and so they've literally never seen my face without a mask before. And that was like a crazy reality moment for me because we have some residents in our building who I have worked with before the pandemic. And so they obviously know who I am, but all of our new people, like I had one resident go, "What do you look like under there?" So, like to kind of like show and be like, yes, there is a real, like there is a real person under here. So everyone in my facility wears masks, and that includes all of our like non-hands-on staff, all of our administrators, all of our housekeeping, custodial staff. Everybody wears a mask all the time. So it's just different. It's changed a little bit of our culture, which has been weird. I used to seeing people out in the dining room and going to activities, and now it's kind of that battle of loneliness. And sometimes I feel like I step into like not really a chaplain role, but sometimes I am that one person
Absolutely.
who has enough time to listen to them, which is why I love being an occupational therapist. Mental health is where OT kind of started, and so for me, mental health is very important. So I actually have one resident who is very Catholic and dealing with some other issues. And I said, "Have you ever prayed the rosary before?" Obviously, I'm a Protestant. I don't know anything about praying the rosary. I just said, is that something that could be meaningful? Because I know for me, having like set prayers that I know how to pray can be very, very comforting in a time like this. And this resident was so touched that I did, like, I printed out a sheet and it lists every prayer and like the order to pray on a rosary. I'm still very confused by it, but he said that he's trying. And that to me is all that matters to like, because it's also that tangible, this is something I can see, touch, and feel. And the virus is it's so unknown. It's so like mysterious. There's no end date in sight really, to when our social distancing measures, like as a staff, are going to stop. So, yeah, that feels like it for day to day. It's just the culture change and realizing, oh, you can't just go find them in the dining room in the morning. You have to like actively hunt them down, and they're 9 times out of 10 they're in their room. You know what I mean? But then like our salon lady can't come in, so our activities has tried to step up and like wash and dry the ladies' hairs, because you know how the ladies are about having their hair nicely done. Like, so there's been a lot of like crossover in roles for activities, trying to step up and fill in where, we're not really allowing anybody else inside the building. And there are no family visitors allowed at all. So there's a lot of like FaceTime calls, Zoom. I don't know if we've done Zoom, but I know there's a lot of FaceTime. Towards the beginning, I saw families, they sit outside. If their like family member lives on the first floor, they'll like sit outside their window, and either, they'll call them on the phone, so you can at least see them. But then that's scary for the families too, of like, they don't really know what's going on. Like I talked to a family yesterday and they were like, well, we don't actually know how they're doing because we can't go. So being that bridge of being able to give enough information and an update so they feel like they know how their loved one is doing. And then also knowing that it's a heavy burden to know that I'm the only person that's allowed in the building to see them.
Absolutely.
Yeah.
Absolutely. And when you were talking about the masks, so last night, and this has kind of been a reoccurring thing that I've had to get used to, when an emergency comes in, even the medics on the squad have, it's not the M95, it's the big rubber one with the two big things. And I used to be able to just stand outside the door of the emergency room and listen to what's going on. And I get a picture of what's going, and I can't hear anything anymore because they immediately go into isolation.
Right.
And then last night I had a nurse come out and she was trying to ask me if I knew anything about family for this patient. And I just kept going like, I don't know what you're saying. I have no idea. And so she had to go get a piece of paper and write down. And I had to look at it. I said, oh, okay. But it's just so weird that everybody kind of sounds like the Charlie Brown parents. And one of my roles in the emergency department is when something happens is to kind of be the guy that you could come up to and say, what's going on? And I could give you kind of like a general idea of what's going on. And now I'm like, I can't hear anything. and the team is isolated in a room, so it's not like either of us could just walk in there and say,
Right.
"What's going on, guys?" It's you have to wait until the whole kind of ordeal is stable, and people start coming out and pulling their stuff off to say, "So what's going on?" It's just like backwards.
Yeah.
Yeah,
Yeah. Wow.
yeah, it's different. Different.
Yeah.
No kidding.
So, as healthcare workers, you two see all of us who do not work in healthcare, we see only just a small little tip of the iceberg to what the whole world of healthcare is, especially right now with COVID-19 and everything that healthcare workers specifically have to face. So I'm interested in this. What are you two? I love hearing your bird in the background.
Oh yeah,
I love
sorry.
it. No, I don't want to apologize. It's great.
Yeah, the one is screaming at himself in the mirror. I was doing an hour ago, so.
But as healthcare workers, what are you two seeing during this pandemic, or what are you two seeing about this pandemic? Anything around there that the general public, people like me, might not see?
Hmm. I think we've all heard the stories of people who are in isolation, who don't have a family member or a chaplain to hold their hand, that it's another team member. Most of the time the RN that is in there providing that touch, sometimes using their phones to say goodbye, for the last time for families. I think that's something that it's one thing to hear about it in the news, and it's another thing to work with the people that are doing that, and like
Right.
seeing those rooms physically and being able to be there and say that's happening right here where I'm at. That's not something that I just can kind of casually watch sterilized from my living room. That wow, that's reality right now. I really haven't had the time to put all of my feelings together about it. It's just, I think it's more real. Yeah, it's wild. It's a wild time in healthcare.
Yeah, for I know for myself, I can turn off the TV pretty easily and not really. Today's my day off, so I spent most of my day on the couch either watching Netflix or working through my latest Star Wars novel. So I can ignore this pretty easily if I don't want to engage this. But that's not really, especially for you working in the hospital and you as well. But especially working in the hospital, it's happening feet away from you.
Yeah, and it's almost like this invisible enemy that's everywhere. And is it on the walls or is it on my clothing? When I come home, it's almost like a decontamination process. It's something I'm getting used to. And just stupid things like don't touch your face, Lorenzo. And
Right. Same. Same.
you don't realize how many times you touch your face.
I know.
Or when you put on a mask and your nose immediately starts to itch. That happens to me all the time. I put my nose on. Yeah, I'm like, you're like, I can't do anything about it. Yeah.
Yeah, and then for me too, I'm trying to limit my exposure so that I'm not using PPE, because I want that PPE to be used by people that actually have to go in and touch people and save their lives. So like I don't have the big, we're all fit, all the chaplains are fit to use like these big, they call them PAPR masks, and to do the whole thing. Personally, like I said, my patients are asleep, so I don't usually get to go see them anyway. But then there's another part of me that's like, I would rather save that for a doctor or a nurse that needs to go in there for some intervention that's life-saving. I can pray for people at the door. My spirituality isn't so that I have to like be whispering in their ears or something.
Right.
Yeah.
Yeah.
It's just different because
Mm.
2 months ago, I would have been like, yeah, let's put on a hazmat suit. That sounds cool, right? Yay! But
Yeah.
today it's like, no, I need to be more responsible and a good steward of our supplies.
Yeah. Mm.
Yeah, so I haven't put one on, and it's been very difficult for me, Andy,
Right. Right.
because I want to do the Beastie Boys dance for Intergalactic. It'd be good for morale.
I know you're feeling that as well when you come home. It's almost like you got to have one of those sci-fi decontamination pods right outside your door, where you step
Right.
in, all of that
Right.
you're just completely decontaminated. Then you walk into that.
Like
and then you walk into
from Monsters Inc. Like I need one of those in my house.
Yeah,
I just need a team that's gonna pounce on me when I get home. Says,
with the
"You have
brushes.
it on your back."
Brush.
Right. Yeah.
Yeah.
Yeah, I feel that. I try not to worry about thinking that I'm a carrier, because then that will drive me into like a spiral of I'm not doing enough, and sometimes I feel like I'm not.
Mhm.
All around healthcare, I would just say like not having enough PPE is a real thing right now. Every person in my building is wearing the same mask
Mhm.
every day because we don't have like a surplus of extras. And so that is hard. And also I feel like a kid going on a field trip with my brown paper lunch bag with my name on it that has my 2 mask allotment in there, like my surgical mask to wear when I'm kind of just walking around the facility, and then my N95 that I wear, probably 80% of my day when I'm bouncing, patient to patient.
And then
Yeah.
just so we're that would be unheard of in a non-pandemic time.
Correct. So normally with personal protective equipment, it is a one-time use. So you use it. So when I was doing my field work in the hospital, if we went to an isolation room, there were gowns and gloves right outside the door. You would put it on, and then you would strip them immediately. Like as you were leaving the room, there's a trash can by the door, and you would immediately put everything in the trash can that you did not need. So I know people who are working in hospitals or nursing homes who are like, this is the one like gown that I get, and they're telling us to wipe it down, or you know what I mean? Like they're finding ways to sanitize them, but it personal protective equipment was not meant for this, like for a prolonged experience. So at my facility, there was a short period of time where we could wear like the cloth mask, but then that got shut down. So we all have to wear, even our non-clinical staff has to wear a surgical mask. So that is like my big thing is like that they're not making it up when they're saying there's not enough personal protective equipment, because there's not. I feel really lucky to be in a state that has some good leadership behind it, with Governor DeWine and Amy Acton. I think they're great, but I also have to limit my news intake because I'm living it every day. So overall, my day-to-day life has not changed, because I still get up, I put on my uniform, and I go to work. But then I come home, and like now I have a routine. Whereas sometimes I would like swing by the grocery store after work. I don't do that anymore. I come straight home. I put my shoes in the same spot. I'm really thinking about burning these shoes when this is all over, if I'm being completely honest. Like I just think they're just going to go away. And then, like a specific way, that I like enter my house, and I wash my hands right when I get home from work, to just try to contain that whatever may be in my building, even though I'm in a negative building, does not mean I'm not still exposed to something or anything really. I also think, to piggyback off what you said of people dying alone, that's also happening in nursing homes. For a lot of facilities, the only time someone's allowed in is if someone is on end of life hospice care. So it's hard to watch, knowing that someone who has lived a very long, fulfilled life does not get to have a loved one say goodbye. But I'm very grateful for the company that I work for. We do what's called a graceful transition. So what happens is, after someone passes, We will do an all call for all of the staff who are available. And so when the funeral home comes, any available staff stands in the hallway. Now we all stand 6 feet apart. But we all stand in the hallway, and then as they are leaving the facility, it's like all of the staff, kind of our final respects. So that has been really cool, but also really sad because you know that you're one of the last people, and I don't really know how funerals are working right now. I haven't really like delved into that, if they're even happening at all. Like, I don't really know what happens after they exit the building. But just that small nod of like, I love it because it's kind of our way to say goodbye as a staff to someone that we have cared for and has been with us. So that's been really hard to watch too, just on the inside. Again, kind of some days feeling the guilt more than others of like, I think early on when the pandemic was happening, I felt really guilty about being the only person that was allowed to come in my building to see these residents, and family can't. So that's still like a never-ending battle, but it's a crazy time to be in healthcare, and I'm new to like practicing in healthcare. So like, what a way to start, people. Like, let's just start with the pandemic. Like, it's fine. Like, it's fine. It's fine.
Yeah. Wow. Well, that was the kind of discussion I wanted to have. Was there anything that you two wanted to share that I didn't ask about or I just didn't think about? I mean, don't think too hard about it.
I mean, I think if I get anything across, it's that this pandemic is real. It makes people very, very sick. Some people die, and they die very poor deaths, mostly alone. So protect yourself, protect your family, protect your communities, wash your hands, stay home. Thank God for our governor and fellow Youngstowner, Dr. Amy Acton, for keeping us safe. And just take it seriously. It's no joke.
Yeah, for Church of the Savior people watching this, this is why we cancel. If one of our congregation would get this, and we have a lot of people in the congregation who are in the high risk category, and if one person would catch this and pass away from this, and we were still gathering together, we would be guilty. So that's why we are not gathering together, because we need to keep people safe. We need to inconvenience ourselves in this way for the greater good, for the love of our neighbor. So I appreciate you saying that. Yeah. Anything else you're thinking?
I would say if you know a healthcare worker, thank them.
Yeah.
Thank you, Lorenzo. You work in a way higher risk scenario than I do. And sometimes I feel guilty that I even get to go to work because I'm not in a COVID building. And I know a lot of healthcare people that I follow on Instagram who are working in like extreme conditions with low PPE, who are in hospitals, who, are, I have an OT friend in California who their building has a whole wing devoted to it, and they have set up like outside too. Like, so I would say thank a healthcare worker, wash your hands, just wash your hands. Also, why were you not washing your hands before? Just wash your hands, okay? Like, from all of us healthcare workers, number one, why were you not washing your hands before? And number two, let's just keep doing this when this is all over, okay? Like,
yeah.
Right. Just keep washing your hands. And I know that it's scary with the unknowns. And I think even in healthcare, it's harder because we really have less unknowns. But all we can really do is take it one day at a time. And I would say we need to trust our leaders and trust the healthcare professionals and the scientists who are working on ways to reopen our state. Because it's important for us to lean in and trust them as much as we trust God and we believe and we are faithful people in this time. We also need to use our faithfulness in the leaders that have been appointed to do their jobs well, and that we may follow suit. So if that means staying home a little bit longer, It means staying home a little bit longer. And Church of the Savior, know that we would love to worship with you. We are two young, healthy adults who could potentially pass it on to you. We can't do it. I cannot, in good conscience, go to church knowing that I could get one of you sick. And I would not be able to live with that. So from all of us young people who are saying we're trying to stay home to protect you, we mean it. And I do mean, and I mean it with the most love and sincerity. It is so good to see all of you guys on Zoom, to see smiling faces. It's just good to be together, even though we can't be physically together. So we're trying to lean in and trust our leaders as much as we all don't really like it. We just are trying to lean in and trust our leaders on our next steps forward, which hopefully will mean some less restrictions even in healthcare. But I feel like that will be way after the other things. I just don't know. I'm trying not to speculate about any of it and just take it one day at a time. You know, we get updates every day at my facility too about new policies and procedures. When this first happened, it was like every hour. It was like something new. And I was like, this is overload. But it's still every day for us. Something is changing every day. So we have to be informed and we have to trust our leaders.
So Church of the Savior friends, since you'll probably see Lauren more than Lorenzo, because you don't know Lorenzo.
You don't want to see Lorenzo.
when it is allowed and socially okay, give Lauren a hug the next time you see her, but only when it's okay and only when the restrictions are allowed. Other than that, just reach out to her and say thank you, and to any healthcare worker you know. But right now, we'll probably keep talking off mic. But for right now, we appreciate both of you coming on. I know very well that you know how to say no to me, so I appreciate you saying yes to this. But I appreciate both of you coming on and sharing your wisdom and sharing this insight that a lot of us, besides what we see on the news, we don't really hear any of this. So I appreciate you coming on and sharing your wisdom and sharing your insight. And to that, I'll just say, rest in peace, friends.